You're the only person who can proactively take care of you. So it's really important that you're going out and seeking information about, why am I taking this drug? How should I be taking it? Do I really even need this drug? Those are questions that you should be asking for yourself.
As we get older, we may be faced with more health conditions that need to be treated on a regular basis. As a result, it's important to play an active role in our healthcare management. On today's Sound Living, managing medications for older adults. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. K-State Research and Extension Adult Development and Aging Specialist Erin Yelland says it's important for older adults to completely understand why they're taking a medication and how to take it properly.
One of the biggest risks that we see with older adults is an issue called polypharmacy, and that just means that you're taking more than one medication. A recent CDC report showed that 57% of older adults take 5 or more medications each day. That's a lot of people taking a lot of medications. And so you can see that if you're taking that many medications, it's really important to understand why you're taking each of those medications and how to take it properly. The statistics also show that 12% of older adults take 10 or more medications a week. So that's a huge number of medications that we need to be managing and managing appropriately.
A lot of this goes back to the pharmacist. They will explain a lot of this. Also, your doctor should be well aware of all those various medications.
Yes, but it's always up to the patient to make sure that you're asking the necessary questions and that you're being proactive in your own health care. Doctors and pharmacists may sometimes forget to explain things in depth to you. So it's important that you take that initiative to say, why am I taking this medication? And ask them, how do I need to be taking it each day so that you take it appropriately?
Is this also something that family members should be aware of too, the medications that maybe mom or dad might be on?
Yes, and that is oftentimes very helpful. If you have an adult child who is nearby or even one that lives farther away, if they can have access to your medication list as well so that they understand what you're taking and why you're taking it and how you should be taking it, so that if something were to happen to you, someone else understands what your medication list looks like and what sort of drugs you're taking.
And you also want to make sure then if a new prescription is issued that you monitor to see if there are any adverse effects?
Absolutely. So one of the things that you should do anytime you take a medication is read that pamphlet that comes along with the medication that lists those adverse side effects. It's also really important to pay attention to potential drug interactions. So there's some drugs that you cannot take in conjunction with others. One good example is that some heart medications cannot be mixed with erectile dysfunction drugs, and that's a reality that we see in older adult men. Mixing those two drugs together can be really harmful for an older adult male. So it's important to understand what medications can be taken together and what medications cannot. It's also really important to understand that some medications cannot be mixed with alcohol, for example. And this is particularly important to consider in older adults because some medications can make older adults more sleepy or more drowsy, and that can really increase the risk for falls in older adults. And we know the risk of falling is already an issue for older adults, but if you're taking medication with alcohol or if you're taking a medication and drinking it throughout the day, that can really increase your risk for falling. It can also increase your risk for memory issues and things like that. So it's important to pay attention to what you can take with your medications and what things you should be avoiding while you're taking a certain medication.
And even whether or not you need to eat before taking the medication.
Yes, that can be huge. There's some medications that if you do not eat with them, it will feel like you're having an appendicitis attack or things like that because it just will start tearing apart your stomach and can become really painful.
How important is it to make sure that you have documentation, someplace easy to find all of the medications that you may be on? You mentioned that some people may be taking up to 10 different medications. That can be a problem if you forget one or two of those.
Absolutely. So it is so important to make sure that you have an up-to-date medication list with you at all times. make sure that you have a copy in your wallet. Make sure that you have a copy at home. It's really important to have that list with you so that if you go to the doctor or the pharmacy, or if you have an emergency medical experience, that you have that medication list with you so that those providers can be aware of what drugs you're taking, what drugs should be avoided, and all those sorts of things.
Is there a benefit to using the same pharmacy over and over?
Absolutely. So it's really important, actually, that you're using both the same providers and the same pharmacy regularly. This can help to really increase your chances for that provider-pharmacy communication so that everyone understands who's in your provider network, what medications you're taking. They sort of understand your medical history and those sorts of things. When you start shopping around to different doctors, or you go to this one time and go to another one another time, the chance that they're going to know your complete medical history, know all about you, know your medications and those sorts of things, that risk can start to increase. And that can be a really scary thing if they prescribe you a medication that you shouldn't be on. So keeping those same pharmacies and the same doctors can really help to improve your chances that you're going to be receiving the best medical care and the best prescription information that you can get.
Another thing that comes into play here in terms of getting your medications is cost. And sometimes that's maybe where people start to stray away from the doctor and the pharmacy, and they start looking online and trying to find the least expensive drug. Maybe there are other ways to save on drugs?
Absolutely. So one of the first things that you can do by maintaining that consistent provider and pharmacy network is that you can talk to those individuals if you're having issues with affording your medications. Oftentimes, there are generic forms of medications that can be prescribed. There's also maybe an alternative medication that does a very similar thing that can be less expensive that might be right for you. So if you're having trouble affording your medication, I would first go to your doctor or your pharmacy and ask if there's another alternative option that you could take that might be more affordable for you. The second thing to consider with your medications and your Medicare in general is senior health insurance counseling for Kansans, and it's also called SHIC. This is a service that many of our K-State Research and Extension agents provide, and this helps you to enroll in Medicare each year. Part of enrolling in Medicare is deciding which prescription plan is right for you. And so if you have that up-to-date medication list, you can take that to your extension agent and say, what prescription plan is right for me based upon these medications that I'm taking? And that extension agent can help you decide which Medicare plan is right for you, which prescription plan is right for you, and really get you the best bang for your buck for your health care. If our K-State Research and Extension office doesn't provide that service in your area, you can still go to the office and ask, where can I get this service in the area? And they can point you to the right direction.
That's really important, especially to do that every year, because as your medication might change, the plan that you need to be on might change as well.
Absolutely. One of the things that we see with older adults and really anyone in general who's taking a lot of medications is that they tend to fluctuate. So if you're taking 5 or 10 medications, sometimes those things will change pretty regularly. You might drop a medication and start on a new one. You might have a new condition come up. So it's really important that you're aware of what you're taking, how often you should be taking it, and then you're able to make those financial decisions that will be best for you.
You mentioned the fact that prescriptions change and you may go off one medication, start a new medication. What's the protocol for getting rid of outdated or medications that you're no longer taking?
So there's generally 3 ways of disposing of medications. The first of which is really the most ideal, is to drop it off at a household hazardous waste drop site in your county. For example, in Riley County, it is called household hazardous waste, and you can drop that off anytime during the week. They also have special mobile drop-off sites and things like that. Many counties also offer prescription take-back days that are sometimes organized by the sheriff's office or a local health department. So if someone in your county is able to take back your medications and they can dispose of them properly, that is the most ideal way to dispose of your medications. When you take it to those mobile drop-off sites, or if you take it to your hazardous waste site in your county, it's really important that you dispose of the bottle correctly as well, not just the medication. You want to always scratch off the label and mark it out so that no one can see who you are, your name, your address, what medications you're taking, because that can make people prey on you if they know that you have certain medications in your home. So it's not only important to dispose of the medication correctly, but also of the bottle.
What are a couple of other ways to dispose of medications?
So a second way is to dispose of it in your household trash. But there's a really unique way that you should be doing it to ensure that nobody is getting a hold of that medication who shouldn't have it. And one way to do it is to take your pills, do not crush them or manipulate them in any way, and mix them up with used kitty litter, with used coffee grounds, with some sort of undesirable substance. Put it into a Ziploc bag and seal it shut, and then put it into your normal trash. Another thing to look for is some pharmacies are now selling disposable bags for your medications, and you can drop your pills into this bag, and it miraculously deactivates all of the medication in the bag, and you can dispose of it in your household trash. And something that we're seeing with older adults is that many of them have issues with pain, arthritis, and those sorts of things where they are being prescribed high-powered drugs. And because of that, they're a target for individuals who want to be taking these drugs illicitly. So it's really important that you're disposing of those medications properly. Another possibility is that if you keep a medication in your home and you're no longer taking it, a friend, a family member, someone who stops by to use your restroom could come in, go through your medication cabinet, and find those drugs and take them.
And to be perfectly honest, I've seen a lot of drugs out on people's kitchen counter. That probably is a no-no as well.
Yes, it's really important that you're storing your medications where they're out of sight, but also out of reach for pets and for small children. And if you have someone in your family, and this is a reality for many people, who is abusing drugs or alcohol, it's so important that you're keeping those medications locked up because you don't want to have that available for them to take and to misuse and abuse.
These are really just meant for one person. There's also never any sharing of drugs.
That's correct, and that is 100% illegal to take a prescription that has not been prescribed to you.
We mentioned the fact that some of these are very high-powered drugs, and there is what's known as an FDA flush list.
Yes, so the FDA, the Federal Drug Administration, has a flush list, and this is a small list of drugs that are approved to be flushed down the toilet. If you simply go on your favorite search engine and type in FDA flush list, it'll be the first thing to come up. And you'll be able to see on that list those drugs that should be flushed. Generally, these are drugs that can be incredibly harmful or even deadly if taken by an unintended person, whether that be a child or a pet or even an adult who the drug is not intended for. These are generally drugs such as fentanyl, morphine, and oxycodone. And these are very high-powered pain drugs that are often taken and misused by addicts, but they can be incredibly harmful if they're taken by an unintended person.
Maybe the number one thing people need to remember is rely on your doctor, rely on your pharmacist, but make sure that you're being responsible for your own health.
Yes, so it's so important that you're utilizing those professionals within your healthcare network to make sure that you are being the healthiest you can be. So utilizing the knowledge of your doctor and pharmacist to help you be healthier is so important. But at the end of the day, you're the only person who can proactively take care of you. So it's really important that you're going out and seeking information about why am I taking this drug? How should I be taking it? Do I really even need this drug? Those are questions that you should be asking for yourself. And it's also so important that you are being proactive when you store your medications in your home and when you dispose of those medications so that you are not providing easy access to someone who may be struggling with opioid dependence and abuse.
That's Erin Yelland, an adult development and aging specialist with K-State Research and Extension. More information on aging-related issues is available at county and district extension offices and on the extension website, ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. and this is the K-State Radio Network.